Good afternoon. I'm Eunice Ndesamiro Masamo, citizen of Kenya, who has actually worked in Kenya. Now I got the problem of the backache, and then after that backache, I was being followed in Kenya. I was being told that, okay, you have a back pressure, so they gave me a lot of massage and rest, but the problem continued on. And then what I did is my daughter called me in America to go and do follow-up. So when I went there, we did follow-up, then the problem was actually identified. But in that moment, when they were actually planning to intervene, it was too painful at that time. Even walking was a problem. So my daughter actually discussed it. We actually went to a website. We got Dr. Rajasekhar Reddy, who actually had to interview me online. And when he saw the signs that my leg was not working very well and I was having pain, he actually advised my daughter to organize so that she can come to Yashoda so that she can actually do some investigation and see where the problem is. So when I arrived here, it was last month. So I was taken through investigations after I met the doctor. So after the investigations, actually it was shown that I had a pressure of my major nervous system, which is supplying the left leg. And the remedy was to actually do a laminectomy so that it can be relieved, and also being corrected to avoid other future problems. So when I underwent that operation, the recovery was very good. And now I think I'm actually out of it and up and around. I'm walking very well. I'm actually given a letter for fit to fly. So I'm planning to leave India on Saturday, coming Saturday of this week. So I say thank you very much, because as much as the doctor was very good and very friendly, and he was very responsive, because every stage he was explaining to me, and actually he was also listening on my question and encouragement. People, the other health workers, without forgetting Dr. Rajasekhar Reddy, and he works with another neurologist who are very good. And then after that, I started. I was taken care very well in the 9th floor. The team was very responsive, very supportive. And then other health workers like physiotherapists who was coming to teach me how to go back again to my legs. The team was very good. The nurses, the supportive staff, and also the workers, the security team were very good. Then after that, after discharge, I continued with the drugs, medicine which I was given, and also taking instructions on how to carry myself so that I don't hurt my back. And all goes well. When I came for review, surgeon was very impressed. Actually, after repeat X-ray to affirm that what they did was okay and on the correct place, and actually they did laminectomy, and I have some 6 screws in my back. So after that, the wound the stitches were removed, the wound was healed very well, and then I was also referred to the physiotherapy, who gave me the package of doing physiotherapy until I recover completely. But after 2 days when I came back, the doctor gave me the letter for fit to fly, which I'm actually planning to leave on Saturday.